Hello, my name is Dr. Mary Money. I'm a board certified internist and I've been practicing in Hagerstown, Maryland since 1979 as a primary care physician up until last year. Last year, I transitioned and started a telemedicine consultation service so that patients would be able to get a second opinion on medical concerns without leaving their primary care doctor. Tonight, I would like to provide some information to the upcoming generation of providers about how to communicate with patients and what type of things are important. I hope you will enjoy this. Communication with the patients is probably the most important thing that you can learn and practice. It takes time. It's really important to focus on the patient and not on the computer. Words are only 5% of the communication. It's important for you to look at the patient, to smile, to greet them, and to ask the appropriate questions. Their body language and your body language are very important. Make sure that as you talk to the patient, you don't see them begin to cross their arms or cross their legs. If you do, that means that you have probably touched on something that's sensitive to them and you need to try to do a different tactic to get some information. What is your tone like? Are you upset? Are you angry? Have you been bothered about something that happened previously with a prior patient or something going on in the hospital? It's important almost to become like an actor or an actress when you walk into that room. Don't let something that has happened before bother you and carry it over into your communication with this patient. It's always challenging when a patient comes in with a suggestion about their care. But be patient, listen to them carefully, and take what they say into consideration. This is important to develop trust with them. And remember, we don't know everything. It's important to ask questions and to work with others because this is a team effort to take care of these patients. As a medical provider, it is important for you to have an independent decision about what the diagnosis is for each and every patient. This means double checking the record, listening to them, examining them, and make up your own mind. Quite often, they will come in telling you what their problem is. It's easy to just accept their diagnosis, but you may be left with a lot of mistakes. Numerous times I've had patients coming in telling me what their problem is, only to find out that's not the case. As an example, one of my patients came in one time and told me that he and his wife both thought he was having heartburn. This was because every time he got some discomfort in his chest, he felt that it was like heartburn, but it had no benefit taking some antacids. Instead, when he got this discomfort in his chest, he would actually lie down and put his legs up on a chair. It turned out that he was having coronary artery disease and had to be sent for a catheterization. So please make your own diagnosis. Review those records, whether it's from the emergency room, another hospital, or another provider, and decide for yourself whether that was accurate or not. This statement is still true today that the most crucial step toward healing a person is making the right diagnosis. As providers, we all now have computers. Unfortunately, computers will take us away from looking at our patients. Please talk to the patients first, take the history, do your examination, take some notes, and then dictate the evaluation after you have done all these things. Don't try to type while you are talking to the patient. That only distracts you from dealing with the patient and is not good communication. It is easy to think that what we tell a patient they have to do. However, patients have the right to decide what they want to do and what they will follow. In order to help them to improve their health, I encourage each of you to become a coach, not a dictator, not a manager, not a professor. Talk with the patients and explain to them what would be best in their interest and try to coach them toward a better outcome. It has been my experience that the history that the patient provides is the key to making the diagnosis. So therefore, I have a tendency to ask 1,000 questions to try to figure something out. First, however, I ask the patient to tell me what they think is going on in their own words. After that, then I may ask them to become a detective like Sherlock Holmes and write down things. I'll give them a ton of things to pay attention to. When did your symptoms start? What were you doing? What makes it better? What makes it worse? What have you tried? Does it happen when you're lying down? Does it happen when you're standing up? What other symptoms might you have? Where does the pain travel? All these things are important clues to try to figure it out. Don't jump to conclusions after the patient has told you a sentence or two. Give them time to explain their problems. You might be surprised at what you can figure out. Another tip is to ask permission from the patient before telling them something or giving them additional information. Don't just simply hand them a sheet and say, here, do this. Instead, if you want them to lose some weight, ask them if they would like to have more information about how to do that. Or if you want them to start exercising, ask them if they need any suggestions on things that they could try. It works better to get them to do things by having them become a partner with you. For years, I used to be quite upset when I would review a chart and see that some lab test wasn't done, or the patient hadn't gotten an x-ray, or they hadn't done this, or they hadn't done that. And I might ask them, well, why didn't you do this? That only made them more defensive. So after years of practice trying to figure out what was the best way of asking about why something was not done, I figured out the following phrase, and I use it all the time now. It is, as I've printed here, have you had a chance to? Whether it's have you had a chance to get the blood work, have you had a chance to get the x-ray, have you had a chance to look up that information that I gave you? It turns out quite often that the patient actually did what I asked him to do, and I never got the lab report or the x-ray. So please memorize this phrase. It will serve you well in the future. Unfortunately, what you learn now, tomorrow, the next day, may not be accurate within a few years. Medicine is constantly changing, and when I was in school, I was told that 50% of what I learned then was going to be obsolete in 5 years. Unfortunately, you don't know which 50, so it's important to keep up and constantly strive to learn new things. This is a list of potential sources that you could use to keep up in the field of medicine. I'm sure that there are going to be many more coming down, so just try to be abreast of this and ask others for suggestions. Medicine has been a very challenging career. However, I have enjoyed almost every moment of it. Not necessarily when I had to get up in the middle of the night to go to the emergency room, but taking care of patients and figuring out their problems has been quite rewarding. My father mentioned to me that there was going to be times when I felt that I knew something, but I didn't know how I knew it. He said, trust your instincts. That has served me well, and I hope it serves you well too. Medical problems are usually quite logical. They may not have been written up in books, but if you can sort of put yourself into the patient's shoes, you might be able to figure out what's causing that unusual medical condition. Never stop asking questions. Ask others if you do not know the answers. Be willing to take care of your patients with others also being involved. Taking care of a patient is a team effort. It's important for you to be part of that team too. I hope you have enjoyed this. I hope it's been helpful to you.